Hi, good evening. Can you hear me? All right. Hi, good evening, everybody. I'm Dr. Mohit Saraogi. I am an IVF specialist and I practice in Mumbai, Malad. I have my own IVF center in Malad, Delhi, and we've also got additional branches in Mulund, Ghatkopar, and Andheri. We do a lot of fertility practice, so we help women get pregnant through a variety of means and measures. Now, the objective of today's talk is to simplify fertility treatment completely for all of you. Now, let's start from the basics. Okay, if you look at the overall incidence, I think you cannot hear me. Hello, can you hear me? Can you hear me? Can you hear me? Is it now without the earphones? All right, so let me restart. Hi, I'm Dr. Mohit Saraogi. I'm an IVF specialist and I've got my own fertility center in Mumbai, Malad. We also have branches in Andheri, Ghatkopar, and Mulund. And between our centers, we do a large number of fertility cases month on month. Now, today I'm going to try and simplify the fertility process for you and help all couples who are trying to get pregnant understand the whole process and understand how this whole process works. Now, the reason why we need to address the fertility issue is due to high prevalence. In fact, in Bombay and in India, the prevalence of infertility is about 10 to assistance for fertility treatment and fertility conception. To understand the problem of infertility, we first need to understand how natural pregnancy takes place or what is the process of natural pregnancy. And to help out with this, I've got a small guide here. Now, if you will look here carefully, you will see that this is the uterus, this is the vagina, these are the tubes, and this is the ovary. Now, normally what happens is every month inside the ovary, a follicle is going to develop. This follicle then ovulates around the 15th day of the period, and the follicle eventually comes inside the fallopian tube. Now, the thing that you need to remember is that the life of the egg is only about 12 hours. That means every month, once we ovulate, the egg will be alive in the fallopian tube only for 12 hours. Now, at this point of time, if we try for a pregnancy, either by natural means or by IUI, there is a possibility that we may get pregnant. However, if we do not have relations on that particular day, principally speaking, the entire month is lost, and you're going to have to subsequently retry again on in another month or at another point of time. So, what you need to understand is once the egg has come inside the tube, its life is 12 hours, and at this point of time, you need to try and get the sperms as close to the egg as possible. Now, there are two methods of doing this. One is relations, where the sperm sample gets deposited here, and the second is IUI, where the sperm samples are deposited directly inside the uterus and close to the fallopian tube. Now, we need to understand that the causes of infertility can be three or four. There can be a problem with the ovary, which is why the eggs are not developing. The problem can be with the tubes, which, if blocked, will prevent a natural pregnancy from taking place. The problem can be with the uterus, where there are fibroids in the uterus, or the uterus is deformed and it does not have the ability to carry on the pregnancy further. And lastly, the problem can also be with the sperms. That means the sperm count and quality can be on the lower side. So, principally, how do we examine a couple coming to us for fertility assessment? Principally, we need to first examine both the partners. A good history taking will very often tell us what the problem could be. For example, if a woman says her periods are coming late, the problem could be PCOD. That means that is why her cycles are coming late. Or it could be that her ovaries are failing prematurely, which is why her cycles are coming late. Second, okay, the couple may say that the coital frequency is inadequate. That means they're not having sex often enough. And as a result, they're unable to get pregnant. In such a situation, a process like IUI may be the answer, or time intercourse may be the answer. Very often on history taking, we find out that the problem is erectile dysfunction. That means the husband is not able to get an erection. Here, there could be a psychological factor involved. Also, there could be other organic factors such as diabetes, thyroid, and other problems could also be involved with this. And these issues would need to be addressed. So, first thing we do is a good history taking and try and narrow down the possible causes that are there. The second thing that we do is we would like to evaluate the male for the sperm count and the sperm motility. Now, for this, the husband has to come to the center and give a semen sample, or he can do a home collection and bring it within 30 minutes of collection. Here, what we are looking for is the sperm count, the sperm motility, whether the sperms are mobile or they're immobile, and see the sperm morphology. That means are the sperms normal, or sometimes the sperms could be abnormal, and that could be the cause for the infertility as well. So we need to do a good semen analysis, which has to be done with 3 days of abstinence. Then we also like to evaluate the woman. Now here, the basic tests that need to be done is a good transvaginal or an internal sonography. Here, by doing the scan, we should be able to see the uterus, the ovaries, and the tubes, and we'd be able to get an idea as to whether the woman's ovaries are healthy and the uterus is healthy or not. Remember, a sonography does not tell us whether tubes are open or blocked. It can only talk about the uterus and the ovaries. So we'd like to do a good transvaginal sonography. Based on these findings, we would often recommend blood tests for the woman. Now, the commonly done blood tests are thyroid and blood sugar, as well as prolactin, which are basic body hormones. And derangement in these hormones can affect the egg quality. So we'd always like to do a thyroid function test, a prolactin, and a sugar assessment for the woman when she comes to us, in addition to the transvaginal ultrasound. Now, we've already discussed the causes of infertility can also range from the uterus to the tube. In some situations, such as infection, the tubes of a woman, which are the fallopian tubes, can be blocked. Now, if the tubes are blocked, the sperms, whether deposited here or here, will not be able to meet egg within the fallopian tube. And if they are unable to meet the egg, a baby or an embryo will not be formed, and we will not be able to conceive. Hence, very often it is important to confirm if the tubes are patent or tubes are blocked. When I say patent, whether they're open or not. Now, there are two principal methods by which we can test whether the tubes are open or blocked. One is a process called HSG. The other is center. An instrument is put inside the vagina, injected from here. Now, the dye will pass through the uterus and into the tubes. And while this is happening, you will take an X-ray film of the abdomen of the lady. This X-ray plate will show the uterus getting filled with the dye. It will also show the dye going into the tubes. And if the tubes are open, it will show the dye spilling out. However, if the tubes are blocked, the HSG will tell you the tubes are blocked. And in this situation, you know that the tubes are responsible for the infertility. The only drawback to an HSG test is that it can be quite painful for a woman, although the pain is transient and it lasts only for about 1 hour. And this test is only done on the 7th or the 8th day of the period. Very often, when a woman is not willing to go through an HSG due to the pain factor, an alternative option is a Hysterol Laparoscopy. Now, this is an endoscopic surgery or a minimal invasive surgery. Here, the woman is given anesthesia, and while she is unconscious, a telescope is put through the umbilicus. With this, we visualize the entire uterus, we visualize the tubes, we push a dye, and we see whether the tubes are patent or tubes are blocked. If the tubes are open, you'll see the dye spilling out real time, and this is the most accurate method of finding out whether the tubes are patent or the tubes are blocked. So with this, we complete the investigation profile for a woman, for fertility treatment. So we've evaluated a uterus on sonography, we've evaluated the ovaries on sonography, we've also seen whether tubes are patent or blocked. Based on the individual problem, we will also look for a solution. However, there are going to be certain situations where everything is absolutely normal. The uterus is fine, the tubes are fine, the sperm count is fine, and the ovaries are also fine. Such situations are called unexplained infertility. Unexplained infertility means there is no particular reason why the woman is not able to conceive. Here, there are two popular theories which could be responsible for the infertility. One is the egg quality could be poor. Now, remember, whenever we are evaluating a woman, and doing a scan, the only thing that we can see are follicles. You can't actually see the egg inside the follicle. The only time you're going to visualize the egg is if you're doing an IVF procedure and you actually retrieve the egg outside the body. So, commenting on the egg quality on blood tests and on a sonography is not possible. And a bad egg quality could be one of the reasons for unexplained infertility. The second thing is the environment inside the tube can also sometimes be bad. So we've already discussed the tubes need to be open or patent for pregnancy to occur. But what we do not understand is that the baby is initially formed within the tube and it's going to survive within the tube for 3 days before it actually reaches the uterus where it's going to implant and survive for 9 months. So For those 3 days, it is very important to have a healthy tubal environment for the baby to sustain and survive. If the tubal environment is unhealthy, okay, the pregnancy may not survive, and this could be another reason that is responsible for unexplained infertility. Now, there are three popular treatment modalities that fertility consultants offer. One is planned relations, the second is IUI, and the last resort is IVF or test tube babies. Now, once we are convinced that the tubes are open and everything is okay, what we would like to do is we do something known as ovulation induction. That is, we are going to give the woman tablets and certain medicines which will act on the ovaries and produce multiple follicles at the same time. By producing more than one follicle or more than one egg in a given month, we increase the chances of pregnancy due to the higher number of follicles formed. Then we do what is known as follicular monitoring. That is, we do an ultrasound from the 9th or 10th day of the period, and this is done every alternate day. And we track how the follicles are growing and how the endometrial lining is building up. When the follicles are eventually ready, we're going to give an injection for the follicle to rupture. And once ovulation has occurred, this can be seen on a transvaginal scan very easily. We know that the life of the egg is now 12 hours. Here, we are going to either ask the couple to have relations on that particular day and the next day so as to maximize pregnancy chance. Or second, we may do an IUI where the husband comes to the center, gives a semen sample, then the andrology team washes the semen sample. That means they put it in a centrifuge machine, they remove the dead sperms, they remove the unnecessary fluid, they separate the good sperms. They add a media or solution which is rich in fructose or energy source to improve the motility of these sperms. Then these sperms are loaded into a catheter or a tube, which is then passed into the vagina, and all the sperms are deposited near the opening of the tube, where the tube connects with the uterus. Now here, you are able to deposit a maximum number of sperms as close to the egg as possible. And by doing so, you can very often double the chances of pregnancy as compared to planned relations. In planned relations, the sperms are deposited in the vagina. Very often there's a backflow. So, you tend to lose semen volume and sperms there. A lot of sperms stay trapped in the vagina. A lot of sperms get trapped within the cervical canal. Hence, very few sperms actually make it into the fallopian tube. As a result, chances of pregnancy with planned relations are only about 7% if the sperm count is normal. If the sperm count is lesser, chances could be even lower. Whereas the chances with an IUI, if properly done, could be almost 13 to 15%. That means it could almost double up as long as the sperm count is normal. Very often in a fertility practice, we initially start with a planned relation cycle. That means for the first 3 months, we would do an ovulation induction, build the follicles. When the egg ruptures, we're going to ask the couple to try naturally. However, if that fails, then we would move on to IUI after confirming that the tubes are patent, either by doing an HSG or by doing a Hysterol Laparoscopy. Now, statistically speaking, you need to remember that even an IUI has a success chance of only about 13 to 15%. So, for a couple to expect that they're going to get pregnant in the very first month having done an IUI would be a little unfair. This is a process that could take time, and a fair amount of time for IUI would be about 4 cycles. A number of studies have shown that most couples who are likely to get pregnant with IUI are likely to get pregnant within the first 4 attempts. Hence, we must try for an IUI at least for about 4 cycles. And then after that, we can evaluate, more advanced treatment modalities such as IVF, ICSI, or test tube babies. Now, there are certain situations where even IUI will not work. Now, this would be where the sperm count is very, very low. So, if the total motile sperm count is less than 5 million, it is understood that an IUI is likely to be an unsuccessful treatment modality, and IVF or test tube baby would be the treatment of choice. So now coming down to the last treatment option which we offer, that is called test tube baby or IVF or ICSI. Now here the concept is we have to remove the eggs from a woman's ovaries, take the husband's sperm, fertilize it artificially in the lab, create the embryo or the baby, and then put it back into the uterus. Now this process starts from the second day of a woman's periods. From then, she's going to be given injections every day for about 11 days. These are hormonal injections which are absolutely safe. They do not interfere with her day-to-day activity. She can carry on with the routine work. Now, while giving her these injections, a number of follicles will develop simultaneously. Younger the age, more the follicles. If a woman is about 20, 25 years of age, very often she may develop around 15 to 20 follicles also. Now, the growth of these follicles or eggs is tracked by doing an ultrasound every 3 days, or every 2 to 3 days. And once we see the follicles have reached their maximum size, we surgically remove the eggs by a process called ovum picking. Now, this is a very simple process. Okay, it's no major surgery. The woman is admitted in the hospital for about 4 to 5 hours. She's taken into the IVF operation theater, where the anesthetist gives her an injection and sedates her or puts her to sleep for about 30 minutes. Then, when she's unconscious, we do an internal sonography for her. And while doing the scan, we will pass a needle from the vagina directly into the ovary and suck out whatever eggs are there. So that way, you're going to get about 8 to 10 eggs. Once these eggs are removed, these are handed over to the embryology team in the IVF lab, who examine the quality of the eggs under a microscope. Then, the husband also gives the sperm sample simultaneously. First, the sperm sample is washed and cleaned. Then, the sperms are examined under a microscope too, under 400 magnification. And the single best available sperm is selected so that this can be artificially fertilized with the egg in the lab. Then, what the embryology team does is, under the inverted microscope, they take a single egg and inject the sperm directly inside the egg. Now, a sperm is much smaller in size as compared to the egg. Hence, it can directly be put inside the egg, and this forms what is known as the embryo or the zygote. Now, the baby is allowed to grow in the lab in a machine called the incubator, which is basically an artificial uterus. There, the babies are allowed to grow. Medicines are given with the help of media. That is what provides nourishment to the baby. The environment is replicated to that of the uterus, same as that inside the uterus. And the babies are allowed to grow in the lab for about 3 to 5 days. Some people like putting the embryo back on the third day into the uterus. Others put it back on the fifth day, which is known as blastocyst culture. Now, what is believed is that those embryos which are genetically weak may not survive till the fifth day. Hence, if you're putting an embryo back in on the fifth day, which is known as blastocyst, those embryos are likely to be genetically stronger. And when you put it back in, your pregnancy chances are supposed to be higher. Hence, very often while offering an IVF cycle to a patient, we suggest that they do a day 5 transfer or a blastocyst culture and transfer. However, there is a type of IVF treatment which is even more advanced than a day 5 transfer, and that is called as a freeze-all treatment. Now, this is a kind of IVF treatment which takes close to 3 months to do. Here, in the first month, we do the stimulation, that is, give the injections, grow the follicles, remove the eggs, fertilize the egg and the sperm, create the embryo, grow it till about the fifth day. But we do not put it back into the womb in the same month. We freeze it and store it at minus 200 degrees C. Freezing is an absolutely safe procedure where the babies are put in a straw. The straw is sealed and kept at minus 200 degrees C. This way, the embryos can technically be stored indefinitely without causing any damage to the embryos. Then, 1 month rest is given to the body of the woman. And a month later, we then start working on the lining of the woman's uterus. So she will come back to us a month later during her menses or periods. We are going to give her tablets to eat, which will build her uterine lining. And then we will monitor how her endometrium or uterine lining is growing by doing a sonography every 5 to 6 days. Roughly 15 to 20 days later, her uterine lining will be optimal, or it will reach its maximum value. At this point of time, we will remove the frozen embryos from the store and then put it back inside the uterus. A frozen embryo transfer is known to improve IVF results by about 50%, at least in our setup. Now, there are a number of theories which are postulated for this, and the most commonly accepted theory is that the quality of the uterus and the quality of the uterine lining is much better. When you freeze an embryo, no damage happens to the embryo. Embryo is absolutely safe. But you need to understand that when we are removing the eggs, we are actually doing a surgery. We are putting a needle into the ovary and then sucking the eggs out. Now, this is some kind of injury or trauma which you're causing to the ovary, and it might be minuscule, but it is still there. As a result, there is some swelling inside the ovaries which occurs. Now, wherever there's a swelling in the body, it can't be independent. If there's swelling in the ovaries, the uterus is just adjacent to the ovaries, and there's bound to be some swelling there as well. And the ability of the uterus to hold on to the babies when you put it back in is likely to be reduced because of this swelling. However, if you're going to freeze the embryos for a month, all of this swelling disappears. the uterus and the ovaries comes back to its normal baseline state. And then when we work on the uterine lining, we get a much better quality of endometrial thickness and a much higher implantation rate. As a result, the best method of IVF treatment would probably be a freeze-all treatment. And the last in the fertility treatment options is a surrogacy treatment. Now, surrogacy is a treatment modality where babies are created by the process of IVF, but it's put into another woman's womb rather than her own uterus. We very often need to do this if a woman has undergone a hysterectomy, that means a uterus has been removed, or if a uterus is so damaged that multiple IVF cycles have failed and the uterus cannot hold on to the embryos which have been created through the process of IVF and ICSI. Now, as of now, although surrogacy is legal, there is a bill being passed in the parliament which may make it difficult for surrogacy in the very near future. But as of now, commercial surrogacy is legal, and we can presently create embryos through IVF and put it into the womb of a surrogate mother for commercial reasons, although this may stop very shortly. So that is the last in the fertility treatment options. So with this, just to conclude, we need to understand that fertility is a growing problem in developing countries like India, and it is highly prevalent. If you're young in age, what we suggest is that you must try regular unprotected intercourse around the ovulation period, which would be from the 12th to the 16th day of your cycle, assuming your cycles is regular, month on month. If after 6 months of regular trying, you're not able to conceive, then you need to go see a fertility specialist like myself, who will then like to evaluate you and understand if there is a reason for the infertility. If everything looks okay, we may opt for an IUI treatment or planned relation cycles initially. In case IUI cycles fail, or there is a gross problem like the sperm count is very, very low, we may opt for a test tube baby treatment or an IVF or an ICSI treatment as well. So based on that, there is no such fertility problem which cannot be addressed in today's times. The only thing that you need to remember is that this is a treatment modality that can take some time. There are no quick results, there are no shortcuts. Give it time, give it patience, have faith in your doctor, and the results will come eventually. So with that, I would like to thank all of you for listening to what I have to say. And I think we should probably now move on to the question answer session. So I have some questions here. There is a question from Mr. Sujit Kumar. And he says, hello, doctor, greetings from Sujit Kumar. I have a sperm problem. How to get it done and get the right sperm count? Okay, Sujit, thank you for asking me this question. Now, a sperm problem, okay, could be the sperm count is on the lower side, or the sperm motility is on the lower side, or both could be affected. Now, there could be a medical reason for this, and there could be lifestyle reasons for this, and sometimes there could be absolutely no reason for this. So if you're looking at a medical reason, sometimes there is a condition called varicocele. That means the blood vessels around the testis get dilated. This produces excessive heat in that area, and that can lower the sperm count down. So when a fertility specialist examines you, they may be able to pick up a reason like a varicocele or a hydrocele, which might be responsible for the sperm count. And very often this can be surgically correctable. Second, there could be a medical reason for this. So conditions such as diabetes, thyroid problem can also affect the sperm count, and this would also need to be evaluated. Now, third could be a lifestyle factor. Smoking and tobacco consumption are the worst culprits. Okay, so smokers who've been smoking for many years, or those who've been consuming tobacco for many years, very count and motility is likely to be on the lower side. And saying that I quit, smoking tobacco consumption 3 months ago, 6 months ago, a year ago is no excuse, because the damage is very often irreversible. In such a situation, the only thing we can do is give vitamins, antioxidants, and try and take it forward. Understand how bad the sperm count is, and based on that, maybe opt for an IUI or IVF treatment after giving appropriate antioxidants that are there. And the worst in this particular criteria is unexplained male factor infertility. Here, very often, other than palliative or empirical medicines and vitamins, there's not much else we can do. Another problem that comes with sperm count is something called as azoospermia. That means sperm count is absolutely zero. Here, there are two reasons why that could happen. One is there is no sperm production. That means the factory itself is not working. The testis is not working. And here, no line of medical treatment will work. we will have to take sperms from a sperm bank or donor sperm sample and then take it forward. And the second is obstructive azoospermia. That means the sperms are getting produced, but they are unable to come out. Here, we can give you your own biological child through the process of IVF. So what is done is on the day we remove the eggs in IVF, we also do a testicular biopsy or a TISA procedure, which means we put in a needle into the testis and remove some sperm tissue from there, isolate the sperms from that particular tissue, and use it to create your babies or embryos in the lab by the process of IVF and ICSI. So azoospermia also needs to be evaluated, and very often in 50% cases where it's obstructive azoospermia, we can conceive with our own biological child. The next question is from Varsha. She says, Doctor, what is the process for fertility treatment? My age is 32 years. Varsha, on the age factor, your age is slightly on the higher side. Okay, so Varsha says that my age is 32 years and I'm not able to conceive. So you need to understand that the egg quality and quantity starts deteriorating after the age of 30. At your age, I would advise you do not waste too much time. You go see a specialist at the earliest. Let him evaluate, the husband and yourself. If everything is normal, you may want to opt in for planned relation cycles or IUI cycles right away, so that we can expedite the process of conceiving. But I would not suggest delaying a visit to the fertility specialist any further. Now, our next question is by Supriya Kumari. So she says, I got my periods 3 months ago, and the UPT or urine pregnancy test is faintly positive, but not very clear. So here the question, Mrs. Kumari, is this the first time that your periods have come late, or has this happened before also? If this has happened before, one, you may be suffering from PCOD, or second, you may have a thyroid problem. Sometimes a sign of delayed menses could also suggest a low ovarian reserve, which is dangerous. That could affect your fertility, and that would need to be addressed at the earliest. However, if this is the first time that your period has come late, then this could be due to a retention cyst or due to pregnancy. So for that, you need to go see your gynecologist who will do a blood test called beta HCG on you, will confirm whether you're pregnant or not. If you're not pregnant, there is a possibility that there is a small cyst inside your ovary, which is absolutely harmless, and that has caused your cycle to come late. And a simple medication should be able to induce your periods. So first thing you would do is probably go see a gynecologist or a fertility specialist for the same. Now, our next question is by Mrs. Rajamani. She's asking, what is the correct time to go get tested for fertility treatment? Simple answer would be, if your age is 35 and above, immediately. If your age is on the younger side and you've been trying with regular unprotected intercourse for 6 months and it's not worked, then you need to go see a fertility specialist. Okay, our next question is by Mrs. Durga. So she's asking, what is the cost of fertility medicines, and does insurance cover fertility treatment? Durga, the cost of fertility medicines depends on the treatment. In IUI treatment, the medicines can cost you anywhere from 3,000 to 5,000 rupees. Also, the treatment costs and IUI costs would be separate. So somewhere the whole process could go around 10,000 rupees. However, okay, insurance companies may not cover infertility treatment. However, in corporate policies, a number of companies do cover it. So you'll have to check with your policy provider whether fertility treatment is covered or not. Regarding IVF treatment, the overall expenditure for IVF treatment comes close to 1 lakh rupees, because injections, medicines, disposables, everything are on the more expensive side. Hence, this is a slightly policy covers fertility treatment. You should be able to get it reimbursed through your medical policy channels. Now, our next question is by Mrs. Bhavna. She says that it's been She says, are there any non-medical approaches to getting pregnant? For example, relaxation, meditation, and Ayurveda. Very interesting question, and the truth is, you're probably right. In a number of cases of unexplained infertility, it might just be stress which is responsible for you being unable to conceive. In one of the good things that has come out of the lockdown period is couples have spent more time together. A number of fertility couples who were looking for fertility treatment have managed to conceive naturally just because they've spent more time together and have been under less stress. So yes, okay, meditation, relaxation therapy will help you conceive by keeping you in a relaxed frame of mind and also improving the egg and the sperm quality and can definitely be attempted. With that, I think I would like to thank all of you for very, very patient listening. I don't think I can take any more questions because we have run out of time. And with that, thank you very much. All of you have a very good evening.